Genetic counseling is the process by which the patients or relatives at risk of an inherited disorder are advised of the consequences and nature of the disorder, the probability of developing or transmitting it, and the options open to them in management and family planning.
But how do you know if this type of counseling is actually right for you? That is why our pregnancy expert Judith Schuler is here. Now, we kind of gave I guess a definition of genetic counseling, but really break that down for us.
Well, first of all, many people do not even know about genetic counseling, and it could be applicable to a lot more people than are getting the genetic counseling. A lot of people don't realize that genetic counseling should be done before pregnancy if possible, and oftentimes it's not recommended until after a couple has a baby that has a birth defect or a problem, and then they are told to seek genetic counseling.
So it's really something that couples especially need to be looking at before they even try to conceive.
Right.
So what are the steps in doing this?
Well, first of all, let me tell you what genetics is. As you said, it's the study of characteristics and traits that parents pass on to their child through the genes. Genetic counseling is a meeting with a person who is very well versed in genetics and the couple. And then they talk about various things that could occur. And what happens is that when they have this meeting, the genetic counselor will do a lot of medical history, family history, medical history of the couple. They'll talk about backgrounds. They'll talk about things they've been exposed to, maybe in their workplace, like lead or things like that. And so it's a big information session. Then they talk about the tests that could be very beneficial for these people, because not everybody needs every test. You only need particular tests based on your particular situation. So then, this is the key. No one makes any decisions for the couple. The couple decides whether they're going to have the test. And then if they do have the test, they all meet and talk about the results. And if there are decisions to be made about whether to have a pregnancy or use donor sperm or a donor egg or something, then it's the couple that makes the decision. No one makes the decision for the couple. They're just given the information and then they decide what to do.
I'm glad that you're making a line between these two, because I think some people think if I go in for the counseling, I'm required to do the testing. And I know a lot of couples, that's a very personal decision.
Right. And you may find that you just don't think that that's necessary.
Right, and that's a person.
Or you find out the test results that there's a problem and you just don't think that it's, you're going to go down the road of not having children or something.
So Judy, talk a little bit specifically about things that we might find in these tests.
Well, the tests are going to show you a lot of different things. They're going to show whether there is a problem. Let me back up a little bit. If you are over 35, either person is over 35 when baby is born, then you probably are going to want to consider genetic testing. If you've had a baby already born with a problem, if you've had 3 or more consecutive miscarriages, if you are descendants, now this is both partners, are descendants of Ashkenazi Jews, which is 90% of the Jewish population in the United States, if you're both Latino Hispanic, if you're both Black African American or both biracial, these are things that these groups have problems. And so some of the problems they have are like Tay-Sachs disease, sickle cell disease, cystic fibrosis, epilepsy, heart problems. I mean, not just those people in particular, but these are the kinds of problems that genetic counseling can, let you know that you might have a problem. I didn't realize this till we were doing the research, but cystic fibrosis is the most common birth defect among couples who are both white. And actually, my business partner and co-author, Dr. Glade Curtis, his daughter and her husband had a child that had cystic fibrosis. This was the 3rd child. And then they went to be tested, and they found that they were both carriers of the gene. So, it's something that doctors don't talk about. and they're not giving you the option of going into a genetic counselor and talking about what might be down the road for you. But it's something that you really, really need to consider if you fall into any of those categories.
Absolutely, and education is really where to start, and with that we can do so many things.
Knowledge is power.
Right, exactly, be prepared. So Judy, I want to thank you so much for coming on and talking about this. I didn't know much about it, so I really appreciate you talking about this, and we look forward to having you on again soon.
Okay.
Thank you.
Now, to learn more about your pregnancy, make sure to check out Judith Schuler's series of books. For more details, log on to yourpregnancybook.com.